Hello, welcome back to Bioclass Bites. In this video, we are going to talk about cancer treatments and prevention. Don't forget to subscribe to my channel and like and share this video. This video is the continuation of our previous lesson on the nature of cancer cells. So in this video, we are going to talk about signs and causes of cancer, some common cancer treatments, and how cancer can be prevented. So these are just some of the many common signs of cancer. Always feeling tired, weight loss that occurs without knowing why or unexplainable weight loss, fevers, chills or night sweats, lack of hunger, physical discomfort or pain in particular parts of your body, coughing, shortness of breath or chest pain, diarrhea, constipation, or blood in your stool. However, do not worry because if you just have one of this, that might not be alarming. But if you have several of this, it's best that you go see a doctor because when a cancer is found, several tests will be done to see if the cancer has spread to other parts of your body. So it has to be checked and verified first. So scans, x-rays, and blood tests may be needed before they can conclude that a person has cancer. So what are the common causes of cancer? So actually, doctors really cannot explain why one person develops cancer and another one does not. However, research shows that certain risk factors can increase the chance of a person having cancer. So that includes growing older or getting older, smoking cigarettes and or tobacco, and nowadays e-cigarettes or vaping are also being linked to some cancer formation, exposure to sunlight or ionizing radiation, certain chemicals and some toxic substances, um, some viruses and bacteria are also linked to cancer, certain hormones or abnormality of hormones in the body, having a family history of cancer, alcohol, and other vices, alcohol and smoking, okay? Poor diet, lack of physical activity, and or being overweight are all being looked at as possible causes of cancer. So how can cancer be can be treated? As of now, we really do not have one universal treatment for cancer because cancer treatment depends on the type of cancer, depends on the following: the type of cancer, the stage of the cancer or how much it has metastasized, age of the patient, health status, and other personal characteristics. So there is no single treatment for cancer, and patients often receive a combination of therapies and pain-killing care before they can actually combat and eventually win over cancer. So I know it's quite difficult to imagine that with all our technologies right now, we still have not cured cancer. So I recommend that you watch this video from TED Ed. Why is it so hard to cure cancer? I'll provide the link in the description below. This video also from Corgizast, why blue whales don't get cancer, the Pitos paradox. Again, I'll provide the link in the description below. So these two are required videos for you to watch. So the first one, common treatment for cancer is surgery. So this is the oldest known treatment, and is usually applicable if the cancer has not yet metastasized or not yet spread, because here, the doctor just surgically removed the cancer from the body. So this is often seen in the removal of prostate. Okay, if you still remember our lesson on the male reproductive system, that's one of the glands that contribute to the fluid semen or breast or testicle. Sadly, no, if the disease has already metastasized, it's almost quite impossible to remove them through surgery. Now, this is a video from Nucleus Medical Media, breast cancer tumor removal surgery. So I recommend that you watch this video. I'll provide the link in the description below. This one also from Nucleus Media, radical prostatectomy or the removal of the prostate after it has been diagnosed as cancerous. So watch this video and see how surgery can commonly remove cancer. So I've mentioned that there's really no one single cure for cancer. So sometimes, should the cancer metastasize or the surgery was not 100% successful, the patients can undergo other types of therapies. So the first one is radiation therapy or radiotherapy, wherein um, the patient is bombarded with radiation in order to destroy the cancer by focusing high energy rays on the cancer cells. So, for example, this patient is being prepped or being prepared for radiation therapy. So, possibly the cancer is around here, and then um, the cancer cells in his body will be bombarded with radiation. Sadly, no, since the radiation can also attack the nearby healthy cells, this can cause damage to the molecules that make up cancer, right? And sometimes they can also affect the healthy cells. But the good thing here is that if the radiation can reach the cancer, it can lead the cancer cells to committing suicide, and then the patient will be cured. But this is not a cheap treatment, and this is not just one treatment. It has to be done for several sessions. Another common treatment for cancer is chemotherapy. So as you see here, a patient undergoing chemotherapy. So instead of radiation, the patient's body is exposed or being administered with chemicals that interfere the cell division process. So again, so that the cancer will commit suicide. Because the issue with cancer cells is that these are the cells that are supposed to die if they only follow the cell cycle, but they refuse to die. They are immortal cells, so they keep on dividing. So the goal is for them to commit suicide. So these chemical treatments target any rapidly dividing cells, sadly, in the body. Okay, so their goal is since cancer cells are described as categorized as rapidly dividing, so the chemicals will attack all that. So that also includes rapidly dividing normal cells such as the scalp. Okay, that's why some patients who undergo chemotherapy also end up losing their hair as a result, because the chemicals are attacking the hair follicles, which are actively dividing cells. Okay? But normal cells usually can recover from any chemical-induced damage, while cancer cells cannot. So that's what they were hoping for. You can watch this video from Nucleus Medical Media, Cancer Treatment Chemotherapy. I'll provide the link in the description below. And this one is from TED-Ed, How Does Chemotherapy Work? Again, linked in the description below. So these are other cancer treatments. Okay, the first one will be gene therapy. So here, what the doctors do, or what the patient is subjected to, is the is our procedures that will actually address the root cause of cancer, that is damage to DNA. So if they can alter the abnormal genes of the cancer cells and return it to normal, or delete the part of the cancer gene that causes the cancer formation, then it will return as a normal cell. So that's one goal, okay? That's why genetic engineering is really would really use a lot of STEM professionals, scientists, biologists. We need more scientists and biologists and STEM professionals so that this cancer treatment, gene therapy, can move further forward. Immunotherapy, this aims to get the body's immune system to fight the tumor. So the local immunotherapy injects treatment into an affected area to cause inflammation and hopefully to trigger the immune system cells to fight off the cancer cells. Hormone therapy, because several cancers have been linked to some types of hormones. So this one is hormone therapy is aims to alter the hormone production so that the cancer cells stop growing or are killed completely. So to learn more about the past and possible future of cancer treatment, I recommend that you watch this video from TED-Ed, The Immortal Cells of Henrietta Lacks. I'll provide the link in the description below. So once that we're done with the different possible cancer treatments, so how can we best prevent ourselves from having cancer? So these are just simple tips, and hopefully, you could be able to share this to your family members so that they will also have better awareness about cancer prevention. So cancers are closely linked to the following behaviors, and these are quite easy to prevent. For example, choosing not to smoke or vape or smoke tobacco or cigarettes is actually one good way to prevent cancer. Also, drinking alcohol. So avoiding these two vices can significantly lower the risk of several types of cancer, such as lung, throat, mouth, and liver cancer. So if you have family members who like to smoke, who like to drink, so inform them that just by avoiding these two, it could help avoid being exposed to cancer such as this I've mentioned. Next, scientific studies support that wearing or putting on sunscreen on a regular basis can help you protect yourselves against skin cancer. So we all know that the Philippines is found along the tropical region. We half of the year we have sunny weather. We have a very hot weather here. So it's important that we have to be sun smart. Sun smart. We put on sunscreen whenever we expect to be out in the sun for a very long time. So sunscreen plays a key role in protecting your skin. So when you use a broad spectrum sunscreen with an SPF or sun protection factor of 30 or higher, it can reduce your risk of developing skin cancer, prevent sunburn, and decrease signs of aging on your skin. So always bring with you an umbrella so that when it's hot outside or when it is raining outside, you have an umbrella to protect yourselves. Or if you're going to go to the beach or going hiking, if you will be exposed to the sun for a very long period of time, always wear sunscreen. Diet also plays an important role since most of what we eat can be linked to some diseases. So physicians recommend that 40%. So this, I think this has been your lesson in health in MAPE. So this is the ideal food plate. That 40% of your plate must be made up of vegetables. Only 10% must be from those fats. 25 for carbohydrates or fiber-rich carbohydrates, and then 25% proteins. Okay? So doctors recommend diets that are low in fat but rich in vegetables and grains. So vegetables and fiber could really help your body avoid certain cancers. Certain vaccinations have associated with the prevention of some cancers. So for example, women can actually receive vaccine against cervical cancer. So if they get a vaccine for human papillomavirus or HPV, that can actually reduce their chances of having cancer. So again, this is why we need more STEM graduates because we need more people to research about possible vaccinations that could help people avoid cancer in the future. We'll never know. There's this chance that if our research on cancer continues, there might come a time, even in your lifetime, that all you have to do to avoid cancer is just get a vaccine. If we have vaccine for cervical cancer, perhaps in the future we could have a vaccine against lung cancer, against bone cancer, against leukemia. So imagine how healthy and how longer the lifespan of people will be by then. And then some cancer prevention also includes a manual examination to detect irregularities or tumors as early as possible. So that includes breast examination. So if you're a female, you put your arms above your head and then with your other hand, try to try to examine your breast if you feel any lump or pain, or if you observe some liquid or pus coming out of your nipple, then it's best to tell your parents that you should go see a doctor. For men, okay, so you can also examine your testicles. So if you touch it around and you feel a certain pain around your testicles, it's best to go and see a doctor. Okay, pap smears are common for certain women of age, wherein samples from their cervical tissues or vaginal tissues can be screened to check for various cancers. So these are just simple ways for us to early detect if we have if we have possible cancers in our body. So that ends our video. I hope you learned something new. Don't forget to subscribe to my channel and like and share this video. Till next time, goodbye.